Well, hello everybody. Welcome to Movement is Medicine, the webinar that the Burroughs Clinic has put together for you to teach you about the benefits of movement as a medicinal practice. So focusing on the screen here, the first question I want to ask is, what if there was a medicine that could help mitigate and perhaps cure most health problems? A medicine that could improve lung capacity and endurance, increase endorphins and well-being, create neurogenesis and angiogenesis, which is a fancy term for nerve generation and blood vessel generation, increase strength and functional capability, improve memory and brain function, improve balance, coordination, and neurological function, decrease pain, increase longevity, increase years of someone's life. Also, medicine that could improve soft tissue pliability and tensile strength, which could help one reduce injuries or potential for injury, and a medicine that can improve bone and cardiovascular health and function. Imagine a medicine that could do all that. Well, there is a medicine. Movement is the ultimate medicine for your body. So today, my name is Nick Burroughs. I'm a physical therapist, a movement certified level 3 trainer, a primal health coach, as well as the founder of the Burroughs Clinic. My mission on this earth is to help people create health in their body, to help people overcome health conditions and problems without the use of traditional medical interventions such as pills, shots, and surgeries. This seminar is entitled Movement. So, what is movement? I joke that it's formerly known as exercise, but basically exercise, movement, fitness, they can all be incorporated into the same type of lexicon, but I like the word movement because it sounds more current, more proper. So movement often denotes the act of a functioning body as it changes position under its own power. Movement associated with basic and advanced full body activities such as getting off the ground, crawling, balancing, biking, lifting, bending, twisting, reaching, walking, running, jumping, or even basic activities someone might participate in, like a golf swing, working in the garden. Anytime you're moving your body in a certain way, you can consider that a type of movement. So let's get a little scientific here. Let's talk about the components of movement. Now, I'm not going to define each of these components. They will be brought up later on in this webinar. But so when you're moving your body, the components of it include motor control, balance and stability, postural control, coordination, perception, strength and power, mobility, muscular and neurological endurance, cardiorespiratory capacity, and endurance. These are some examples of just different movements that I would feel myself doing. The one on the left is a strength movement. There's a ground movement up on the upper hand right, and there's a foundational movement on the lower right. But there's plenty of movements out there which is beyond the scope of this webinar. I'm just going to introduce the power of movement, the idea behind setting up a movement practice and what it does for your body. But there are many things you can do with your body to help improve its health in regards to movement. Domains of movement. This is an introduction to these domains: locomotive, manipulative, and combative. Today we'll be primarily talking about locomotive and manipulative, and combative movements we won't include those today in this webinar. So locomotive movements include things like walking, running, biking, balancing, jumping, crawling, climbing, swimming, rowing, moving on the ground. Anytime you're moving your body in space, this is considered a locomotive movement. Also, with manipulative movements, it's basically you handling something, grabbing onto something. Include all sorts of types of lifting, carrying an object, throwing an object, catching an object. And the combative movements are striking and grappling, which again won't be covered in today's webinar. So let's do a quick overview of these functional movement positions. Most of these positions human beings have been in at one time or another. I'll kind of give the scientific description, and I'll let you know, describe what these positions are. So a supine position is basically anytime you're laying on your back, on the bed, on the ground. A prone position is anytime you're laying on your stomach. Sideline is when you're laying down on your side, either the left or the right. The quadruped position is the traditional all-four position when you're on your hands and knees. Sitting position is any position where your buttocks is touching the ground. Kneeling position is a position where one or both knees are touching the ground. Standing position is when you're on 2 feet. The hanging position is whenever you're holding onto an object, actually with your body elevated off the ground. And the midair position is any time that you're doing a plyometric or jumping activity and your body is in the air. So I want you to think about all the transitions and movement possibilities that may happen in all these positions. Most human beings have been in one of these positions at some time in their life, especially as a child. If you go to a park and watch a young child move around and play, they're usually in one of those positions at some point or another. And as you'll see, as we get into our adult years, into our elderly years, a lot of those positions we don't get into. So I want you to consider the stresses on your body in all of these positions. I want you to consider what your body needs to be able to perform in order to assume these positions and function in life properly. If you're able to do that, you can hopefully prevent debility as you age. So here's some examples. Think about the hip mobility and stability someone has to have in order to get off the floor successfully. Think about the low back strength and stability that one must have in order to crawl underneath a table to retrieve an object. Think about the balance a person must have in order to step on a stool, to reach overhead and change a light bulb. These are all legitimate positions that every human being must get into at one point or another. So the problem in the Western world is that as we age and as we live our lives, due to the inventions and amenities of our modern world, we do not move our body in the way we are designed to. We do not assume these positions, especially as we get older. So over the course of time, with not being able to assume these positions or not attempting to assume these positions, problems can develop in your body, and then health of the body could be compromised. So here's some examples. Inability to balance properly while reaching over to pick up a flower pot could lead to a traumatic fall and a bone fracture. Having poor lower back motor control and core strength could lead to a herniated disc and or back pain while just picking a box off of the floor. Having weak and stiff intercostal muscles, which are the muscles between the ribs, that could lead you to having a decreased lung volume or decreased lung capacity, which could lead to subsequent respiratory issues, which could lead to inability to walk far due to experiencing shortness of breath because of poor oxygen exchange. Not getting out and walking on a movement or moving on a regular basis could lead to less than optimal perfusion of blood to your heart and body, which could lead to poor blood flow and eventually cardiovascular disease, such as arterial and venous insufficiency. Here's some other examples. Walking outside on a bumpy trail with a weak ankle and poor proprioception could lead to a severe ankle sprain. A man who sits most of the day at work could develop limited mobility in his hips and knees and even back, leading to severe osteoarthritis and pain in these joints. A sedentary individual who is morbidly obese could develop rather severe lower extremity swelling and edema, which might lead to cellulitis and infection. This could also lead to poor glucose metabolism and the onset of type 2 diabetes. And not using your upper extremities on a regular basis, especially in an overhead position, could lead to adhesive capsulitis, which is the medical term for frozen shoulder. So, all those potential problems that might develop in somebody or somebody might be at risk for could be solved with one answer here, which is developing and practicing a therapeutic movement program on a regular basis. A therapeutic movement program is necessary to allow your body to efficiently function with any of those previously mentioned tasks or in any of those previously mentioned positions. This is the ultimate medicine that helps both prevent and treat disease. The Burroughs Clinic has categorized movements as follows. The first movement, and I believe the most important movement to be able to do throughout your whole life, is breathing. It is the first movement a human being performs when they enter the world. And I believe it is also the most important to optimize. You can go hours and even days without drinking, weeks without eating, but you can only go minutes without breathing. So, therefore, breath work or improving your breathing ability is an essential part of a movement program. For example, a regular daily practice you could start to initiate is a simple breathwork technique. You inhale with a 4-second hold, 4-second inhale, and then you hold your breath for 7 seconds, and then you can exhale for 8 seconds. This can be all done through your nasal passages. A couple repetitions of that, and there you have some breath work. Flexibility. Very important. Flexibility is defined as the quality of bending and stretching easily without breaking. Being more flexible allows you to move better and further in space without injury. Flexibility exercises should target every area of your body in all planes of motion. Sagittal, which is front to back, frontal, which is side to side, and transverse, which is the twisting. These exercises should incorporate all these planes of motion, and they can be all combined to where you can perform motions three-dimensionally. So parameters of flexibility. I usually tell people, if you're moving your body and you're moving it through ranges of motion and you're stretching your muscles and all your soft tissue out, that's all you have to do. You can concern yourself with holding your stretches for this long and this long, depending on a specific problem you're working on. But as long as you're moving your body through space, I don't think it really matters how you hold your stretches. Ground mobility. Mobility is defined as the property of being mobile or easily movable, capability of motion or movement. Learning how to become more mobile with ground movements is the best way to start to develop your neuromuscular system. Think about the neurodevelopmental sequence of learning, of motor learning. Children usually start on their back. They learn to roll over first, learn to kneel, then sit before they learn to walk. So if you do ground mobility work, you're replicating that system, and you can better develop your neuromuscular system by doing that. So ground movements help to hone your neuromuscular system, which is your nerves and muscles combined. Foundational movements. These are the basic human movements that humans need to perform in their everyday life just to accomplish functional tasks. So becoming more competent with these makes life much easier. These movements include walking, running, reaching, hanging, climbing, crawling, pulling, pushing, stepping, bending, and jumping. Just think about each one of those movements and how people incorporate those into their everyday lives just to live life. So becoming more competent in these will help your life become easier. Functional balance. So balance is defined as an even distribution of weight, enabling someone or something to remain upright and steady. When you are balancing, you're engaging many body systems, which include vestibular, which is your inner ear, right behind your eardrum, your visual system through your eyes, musculoskeletal, which is a combination of your bones and your muscles working to hold you upright, and your proprioceptive system, which is basically the sensation of feeling your foot on the ground. All these systems come together to enable you to balance properly. So therefore, it's very important to train these systems and to have adequate balance. Having a highly tuned and strong balance system is vital as you get into your elderly years, basically to help you prevent falls. Falls is the third leading cause, falls complication is the third leading cause of death in the elderly. Getting off the ground, this is a specific subset of movements that is very important. These are also called get-ups. Getting off the ground is a fundamental movement that all people need to be able to perform, especially as we age. This subset of movement combines flexibility, mobility, strength, balance, coordination, and motor control. It is the ultimate type of movement. There are various techniques that can be instructed to make easier and more efficient to do so, enabling you to get off the ground easier. Those specific technique instructions is outside the scope of this webinar. But if you're interested, you can just email me at nick@theburroughsclinic.com and I can send you various videos that instruct you on proper get-ups. The key to performing a proper get-up or getting off the ground is to break the movement down and break the movement down into components. Strength. Yes, strength. Very important. Strength is defined as the capability of exerting great physical force either to resist or move something. Being strong allows us as individuals to function in the real world without as much difficulty. Think about what times you need to lift something, to move something. Think about the times that you have to push or pull something out of your way. This utilizes the component of strength. So having a strong body means having a more robust musculoskeletal system capable of taking on different kinds of stressors in life, while also being less apt to injury. You can function easier if you're stronger. Also, being strong decreases the risk for damaging your body during any sort of task. So there are many types of different strength movements, deadlifts, presses, swings, throws, carries. These are all these specific movement instruction is outside the scope of this webinar. So putting all this together, I believe a sound and reasonable therapeutic movement program is the best way to develop each of these categories of movements in order to create health in your body over time. A solid movement program should allow for both aerobic conditioning and resistance training, and you can do that with all the previously mentioned movements. So here at the Burroughs Clinic, we are dedicated to teach you in all of these principles, teach you the proper techniques so that you can safely develop your own therapeutic movement program to help you create optimal health. So consider consulting us to help you get started. At the end of this webinar, there is some contact information. We work both in person and virtually, so we can reach anybody across the world. So consider performing your weekly therapeutic movement program like you're taking a prescription or medicine for your body. Instead of the stigma behind the word fitness, we've decided to call this a therapeutic movement program because it sounds more medical. It sounds as if you engage in this, it's like taking medicine for your body, which it is. Okay, so let's get to the specific medical conditions that can be mitigated or even cured by a consistent therapeutic movement program. Addiction, anxiety, depression, cognitive problems, chronic stress, malaise and fatigue, sleep apnea, pulmonary diseases such as chronic obstructive pulmonary disease or COPD, cardiovascular disease, hypertension, metabolic syndrome, type 2 diabetes, which is an area of specialty we specialize here at the Burroughs Clinic, high triglycerides, hypothyroidism, obesity, poor flexibility and mobility, musculoskeletal injuries, low back pain, chronic pain and pain syndromes, osteoarthritis, and cancer. It's a wide plethora of conditions that moving your body properly helps to mitigate. So here are some few specific examples from the literature. Hypertension, which is a fancy word for high blood pressure. According to a cumulative review of literature by the journal Current Hypertension Report in 2015, the authors concluded that 30 minutes or more per day of moderate intensity activities, such as brisk walking or cycling, and engaging in a dynamic resistance exercise program, which is basically your therapeutic movement program, doing this 2 to 3 times a day per week, 2 to 3 days per week, brings about the best management of hypertension, and that's compared to medication. Osteoarthritis. According to a review in the Journal of Anatomy entitled Exercise and Osteoarthritis 2009, there is no evidence to support the notion that exercise is deleterious to one's joint in the absence of joint injury. In my practice and here at the Burroughs Clinic, we don't accept I got bad joints as an excuse not to move your body. There's always something you can do to help you out. There is no strong evidence to suggest that low-impact exercise, which you could engage in with a therapeutic movement program, is associated with an accelerated rate of development of osteoarthritis or further damage to your knee. The role of exercise therapy was the subject of a systematic review that concluded that there is evidence of beneficial effects such as decreased pain, increased range of motion and function of exercise or movement therapy in patients with osteoarthritis of the knee. And you can extrapolate that to mean other joints or to include other joints as well. Okay, type 2 diabetes, area of specialty for the Burroughs Clinic. According to a study reported in the Journal of Annual Internal Medicine 2007 by Segal et al., the researchers found that exercise training 3 times a week for about 5 months found that both aerobic and resistance training significantly reduced the hemoglobin H1A and C, A1C values, which indicates better sugar or glycemic control, with the greatest reduction noted when combining the 2 types of training together, both aerobic and resistance training. And these people actually saw a reduction up to a full percentage point of their H1A and C. Okay, chronic obstructive pulmonary disease, otherwise known as COPD. A study out of the journal Actamed Okayama 200 by Mirahara et al. Showed that a 3 times a week physical exercise training regimen consisting of respiratory muscle stretching, flexibility exercises, and psychoergometer exercise training, which is another cardiorespiratory exercise training. This showed an increase in a 6-minute walking test, which is a functional test people use to classify and qualify people's functional exercise capacity. It also showed an improvement in the quality of life in terms of shortness of breath or dyspnea, fatigue, and emotional state. So engaging exercise programs help people with COPD out. So these are just a couple of studies highlighting the benefit of movement and exercise therapy relating to the treatment of disease. So I want you to note that these interventions were initiated after the onset of these diseases. The question we need to be asking is, would these diseases even appear if one were already participating in an exercise and or movement program? Here's some other studies. A 2012 study in the journal PLOS Medicine showed that 2.5 hours of moderate exercise per week, which equates to about a half hour of brisk walking a day for 5 days, increased life expectancy by 3.5 years. So just walking every day for 5 days, you'll live almost 4 years longer. Those in the study who upped their exercise intensity actually increased their life expectancy up to 4.2 years. So literally exercising your body makes you live longer. And also another study showed that researchers tested 2,000 men and women ages 51 to 80, those who could stand up without using their hands or getting up without any other help lived longer than those who couldn't. So also this highlights the fact that if you can move your body off the ground in an efficient way without using your hands, which is doable, you'll live longer. So here's some alarming statistics that came across when researching this webinar presentation. Based on current estimates, and this was actually done in 2013, so I believe it's probably a lot worse now. The United States spends more than $2.6 trillion, which is 17% of the gross national product, on healthcare. That's $8,300 per person. But somehow we rank 28th in the world for life expectancy. I have a hard time putting those numbers together and understanding this rank. So our philosophy or our thinking probably should include that drugs, shots, or surgeries should take a backseat to movement and exercise. So here's the mission of the Burroughs Clinic. It's time for a paradigm shift in healthcare. Instead of managing disease, which the traditional healthcare system, that's their whole mission, manage disease. The Burroughs Clinic's mission is to help individuals create health to beat their disease, and through the power of engaging in a therapeutic movement practice, among other things. So here's a quote that I came up with one day. It just came out of me, flew out of me, thinking about the Burroughs Clinic and the mission. And so here it is. The key to avoiding health issues in the future is to prepare your body to do so. Do not pollute your body with harmful chemicals and food. Doing so will expose it to a vast array of potential health problems, including future chronic disease, which is a big thing in this country. 85% of the Medicare dollars or healthcare dollars go to treating chronic disease. Strengthen your body's systems such as the musculoskeletal, cardiovascular, pulmonary, neurological, immune, and fascial systems, which is your skin and connective tissue, all of which will help prevent health issues from occurring. And for some reason, if you become afflicted with an ailment, your body will have a better chance of overcoming it. So here's my own journey. That's me taken in 2009, before I was enlightened to all the benefits of movement and a healthy lifestyle. There's me now, taken in 2021 and 22. 10 years later, I look 10 years younger. So this is your call to action. This is specifically to the people watching this webinar. Start a therapeutic movement practice. All you need to do is 3 to 4 times a week. Each session can only last for 30 minutes. That's all you need. Therapeutic movement sessions can be done anywhere. You can make your movement area in your basement, outside in your backyard, in your garage, at a local park, at a friend's house. You don't have to go to an expensive gym to do this. And please do not drive 20 minutes to the gym to walk 20 minutes on the treadmill. That's just a complete waste of time. If you like gyms, go ahead and keep going to gyms. But I do encourage you to incorporate all those components of movement into your routine. So your movement practice should encompass all of the categories of those movements mentioned previously. Here's another educational piece. 3 key principles to keep in mind when you are doing your therapeutic movement practice and performing it. Keep it variable. That keeps you from getting bored. There's a lot of things you can do. You can incorporate this, and this time, this and this the next time. Keeping it variable, a wide variety, is a type of cross training. Your body needs stimulus from all sorts of different type of movements. So keep the variety principle in mind. Be consistent with it. This has to be done weekly for months and years to really reap the benefits of the therapeutic movement practice. Be consistent. It takes at least 3 months, write this down, 3 months to notice a difference after starting a movement program. You're going to have good days and bad days. Keep this in mind. Fight through those bad days. Be consistent with what you do, and you will reap the benefits later on. And be sensible about your practice. A therapeutic movement practice you shouldn't dread it. It shouldn't hurt you. It shouldn't cause any adverse events such as injury. So do stuff you like, perform things you like. Make sure you don't make it too advanced or use too much weight or do anything that's going to cause you bodily harm in any way. That's one way to stop a therapeutic movement practice, is if you get hurt doing it. So here's an example of how you should break down a therapeutic movement session. And again, if you consult us at the Burroughs Clinic, we can help you develop your own. The first 5 to 10 minutes of your session should be a dynamic warm-up, which should encompass breathing exercises, flexibility and ground mobility components to get your body warmed up. The next part is the emphasis section, where you can actually spend about 5 minutes practicing a certain movement or working on a certain body part that might be giving you some trouble. Say you have some low-grade back pain, you can do some exercises directed at your back during this section of the movement session. And then finally, the conditioning section is the last part of the last component of the movement session, lasting up to 10 to 15 minutes. Typically, what we teach people is to combine 3 to 5 exercises in a row, where you perform 3 to 5, maybe 8 repetitions of the exercise, depending on your level of fitness. And you do that in a row for multiple sets. That way you can develop your cardiorespiratory and cardiovascular functioning by making this more of an aerobic workout. All right, so we are at the last slide. This is the conclusion. I hope that you found this information helpful. I hope that this information inspired you to take up a therapeutic movement practice in order to help you create health. You can find us at www.theburroughsclinic.com to sign up for the free monthly newsletter, or contact us with any questions. You can also visit the Burroughs Clinic scheduling page at heal.me/the Burroughs Clinic. We do have a 3-month-long health empowerment program, which is designed to completely change your body, to completely transform who you are, to completely bring you from a state of illness, ailments, and disease to a state of health and thriving in life. Our email, if you have any questions, is nick@theburroughsclinic.com. And like I said earlier, we specialize in helping others that are suffering type 2 diabetes conquer it. Type 2 diabetes can be reversed, and through our we have a program that these individuals can sign up for. Through our program, which is 3 months, we are very confident that people can reverse their type 2 diabetes. So I want to thank you for joining us, and I hope this information was of great help. We'll see you next time.